My name is S Van Berkel, and I am a third-year doctoral student in clinical psychology at Eastern Kentucky University. My 3-minute thesis is on a topic that touches many of us. About 60% of all Americans will experience a traumatic event in their lives. Of those, about 8% will develop post-traumatic stress disorder, known as PTSD. The core symptoms of PTSD are re-experiencing and avoidance of the traumatic event and feeling on edge. But there are actually two distinct sibling conditions, PTSD and complex PTSD, which are categorized as disorders specifically associated with stress, such as childhood abuse. For a diagnosis of complex PTSD, the core symptoms of PTSD are required, in addition to problems of calming down when triggered, beliefs about oneself as worthless, feelings of guilt, shame, or failure related to the traumatic event, and difficulties in feeling close to others. These core symptoms can be effectively treated by using cognitive processing therapy, known as CPT, and prolonged exposure, known as PE. However, although studies of CPT and PE have shown large reductions in PTSD core symptoms, studies of individuals with complex PTSD symptoms have yielded only moderate results and low recovery rates. To address this gap, dialectical behavior therapy, known as DBT, which was originally designed to treat borderline personality disorder, known as BPD, has sometimes been used as an intervention for those experiencing core complex PTSD symptoms because they often overlap with BPD symptoms. Using a research method called a meta-analysis, my research question examined whether DBT is an effective treatment for PTSD. To answer my research question, I looked at 11 separate studies of DBT being used to treat a total of 274 people who had received a PTSD diagnosis. Results indicate an effect size of 1.42, which is a quite large effect. In comparison, typical effect sizes for psychotherapy are in the range of 0.50 to 0.70. This means that DBT is an effective treatment for PTSD, and it is much more effective than typical treatments. This is an important finding because the data shows that DBT is the most effective treatment for both PTSD and complex PTSD, yet it is not that frequently used. Therefore, using DBT to treat PTSD should be used more widely in clinical psychology. Thank you.